am here today for my patients.
If single-payer healthcare comes to Minnesota, Dr. Elizabeth Frost will be a key reason why.
For a single-payer healthcare system,
Together with internist Ann Settgast, Frost co-founded the Minnesota chapter of Physicians for a National Health Program 5 years ago. They hold rallies and speak at hospitals across the state to recruit new members to their cause. Their ranks now number in the hundreds. Frost also has the ear of progressive lawmakers such as State Senator John Marty and Representative David Bly, who hope to expand health care in Minnesota.
I had a patient who came to see me. He was a retired painter. He was 64 and he had chest pain. I recommended that he go to the emergency room for evaluation of his chest pain, and he refused because he didn't have health insurance. He said, "I'm going to wait until I'm 65 to have this evaluated." About a week later, he went to the emergency room and he had a massive heart attack. And he had a bypass surgery, and then he had some more heart attacks, and then he ended up dying about 2 or 3 weeks later. If the Medicare age limit was 64 instead of 65, then that patient would be alive today. Everybody's health care in this country is what we like to call hospital gown policies that looks like coverage until you walk around the back. The physician's role is actually more than treating that individual patient. It's trying to figure out how to solve things on a grander scale. 5 years ago, we decided to form this group. We now have 1,000 members and supporters. The Minnesota chapter of Physicians for a National Health Program, which is nationwide, 18,000 doctors.
Frost was a key organizer of this month's rally at the state capitol to pressure lawmakers to push for single-payer health care here in Minnesota.
People don't stop getting sick when you take away their health care.
Senator Marty's office, for one, consults with Frost and Settgast on single-payer, from organizing strategy to bill drafting. Frost and Settgast helped Marty craft the bill language for the single-payer bill, SF 18.
I was impressed with her commitment to the issues, to wanting to really make change. It's really important that you have someone of her experience and her stature step forward. I think they have made a tremendous impact in what I've seen in the movement and in the effort to bring single payer to reality.
Through government, we should do together what we cannot do as well for ourselves.
But with President Obama's Affordable Care Act about to be implemented, is single payer really necessary?
You know, a lot of people called Obamacare single payer and couldn't be further from the truth. Even when it's fully enacted, there'll still be like 23 million uninsured.
What if they take that extra 2% profit that they make?
When she's not helping patients, speaking at hospitals, or lobbying lawmakers, Frost often uses street demonstrations to push for single payer.
We've been having protests on the ice every year in front of Stephen Hemsley's house. Stephen Hemsley is the CEO of United Health, and he's one of the highest paid health industry executives in the country. He took in like $50 million in 2011. And that $50 million, of course, is our money. He gets it off the back of you and I. I also learned a lot from Occupy. If we could get that kind of energy around healthcare reform, something could happen.
You don't have to go too far to find efforts to raise money to cover someone's traumatic illness. Those days have to be numbered. We have to get beyond that. Healthcare should be seen as a right. It's a public good, like public schools or public safety.
If I could have $1 for everyone that told me that single payer was not going to happen because it wasn't politically viable, I would be a millionaire. It's like we all need to just close our eyes and jump. How do we get people in the streets demanding that health care is a human right?
Last year, conservative Supreme Court Justice John Roberts surprised many by voting to uphold Obama's Affordable Care Act.
Healthcare is a right.
I think that single-payer supporters likely might have been influential in him changing his mind to uphold the Affordable Care Act. There were a lot of people that I work with that were protesting the Affordable Care Act because they wanted the court to overturn the Affordable Care Act in order to pave the way for single-payer.
What are single-payer advocates doing day in, day out in Minnesota to push for reform?
There's 14,000 doctors in Minnesota. We have strength in numbers. We give talks in hospitals and clinics, also in the community and churches, presented what's known as grand rounds, where all the doctors meet and discuss a topic once a week. We presented this grand rounds at Mayo. We probably got 15 or 20 converts from the 200 people that were there. Governor Dayton's been really supportive in the past, but he is tending to focus on the Affordable Care Act and the health insurance exchange right now. We want to make sure that he knows that we're out here. Each of us wrote a letter to Governor Dayton asking him to enact single payer.
And what's their long-term plan?
What we really would like to see would be a push for single payer passing in Minnesota in 2015.
Today, Minnesota is retaking its rightful place as a national leader in healthcare reform.
Governor Dayton will be in his second term, and he'll feel more liberal to push something like this.